So we need to realize that we're much more and much different um, than this cookie cutter like programming or system that we're kind of getting forced upon us. So we need to be able to ask questions. We have rights and are entitled as patients and individuals that are seeking treatment and enhancement for different forms of movement related things to be able to ask questions, to be able to engage in conversation in which there's a dialogue involved, not a monologue. And so we need to ask questions and we need to ask why, and we need to talk about a plan and an approach and what the individual, what that clinician's kind of route or avenue or pathway for that time as it could change are going to be for us. We need to make sure that we're staying clear of protocols because that's imprisonment, that's very bonding, and we need to think of that as, hey, that's stripping my identity, my personal identity, my personal needs, my goals, my purpose, my joys, my mind, my body, and my spirit. It's taking it away, it's undermining it, it's chopping it down like a tree and saying you're like everybody else. And that's not the case. We have fingerprints and footprints for a reason, for identification. Our stories are unique and our stories are purposeful. We need to take a lot of joy um, in the accumulation of those thoughts, and we need to be able to enjoy the process of working with this individual. So these series of things are really designed to, man, if I for what these individuals are going through, which for some of them is literally life and death, we're oftentimes confronted with some really unique and really rare things that are swept under the rug and that are labeled um, into these clusters and these patterns that are presenting similar to some symptoms that clinicians that we have sometimes seen before. And as a clinician, we can't go at it as that. We have to look at this individual that is spending a lot of time, a lot of money, a lot of sacrifice in a lot of ways with us. We have to give them the shirt off our back. We have to look at you as the patient, and patient, you need to think and say to yourself, does this person that's engaging with me love me, talk to me, respect me as if I were their mom or dad, grandma and grandpa, brother or sister, or one of their great friends? Because that's the kind of care, sincerity, authenticated, and genuine respect that you need to be given with regards to conversation and with regards to this process of figuring out what's going on with you and providing you with our best care to make you better. That's trusting in the process. That is, as a clinician, that's trusting your gifts, trusting your skills, trusting the joy and the love of the conversation that we get to have with people and connecting them to enabling them to close the gap on their genetic potential, live life to the fullest, be able to proudly love their community, love their family, love their friends, and just be a very productive person that throws the boomerang of success and joy and encouragement back on out there. So these episodes are designed to help you out, in that if you get in, I'm not talking just similar situations, but we're all at some point in time as human beings, we're not perfect, we're asymmetrically imbalanced critters. We're going to have stuff that goes on, but we need to be able to be put in a position that drives and facilitates our success. That needs to be prioritized. And so we need to be able to set you up with a foundation of things that you can think, that you can hypothesize on your own, to help facilitate some questions and some conversations in the matter. So we're looking at this to be able to educate you, because even though the clinician is supposed to be the facilitator of those conversations, you're not guaranteed success always with the individual in terms of your clinician, whether it's an MD, a DO, physician's assistant, physical therapist. you're not guaranteed success based on who you've been given and what their day has looked like, how beat down maybe they are. So there's a lot of things going on between both individuals and the stories and the day and the clashing of those two stories at the same time. And if we can help facilitate better questions and better thinking, it's going to make everybody's job, it should anyways, make everybody's job easier, because let's not forget that you as the patient, you provide us with the answers. The clinician just has to be able to be strategizing, hypothesizing, and these wheels going all at the same time, to be able to start hypothesizing what you could potentially be having going on, and then facilitating more questions to funnel things down for you, get you up, move you, run a variety of special tests that aren't based on all these fancy imaging and other things. We need to get back to the root of things. We need to get back to the foundation.